Okay, so this is going to be the first lecture of Chapter 7, Part 1. In Chapter 7, Part 1, we're going to be going over the skeletal system, primarily the axial skeletal system. This as an introduction to the skeleton, we'll be breaking down the different parts of the skeleton, the two kind of main components. And then this particular lecture, I would say, is a little dense. And I'm going to be very clear as to what you need to know and what you don't, because I think it's very easy to get yourself lost here very quickly. Some of the figures I'll be showing might seem a little overwhelming. So please, I think this is one of those lectures that's kind of useful to watch, just because I'm going to point out exactly what I expect you to know, what I expect you to be able to label on an exam. And then I'll probably be updating some of the study guides to reflect that as well. But again, hopefully that will alleviate some of the anxiety when reading this chapter or even going through these slides. Okay, so like normal, make sure you're answering study guide questions prior to coming to class on Tuesday and Thursday. Make sure you've taken care of your quiz 7 by Friday midnight. And then if you're watching this lecture before, or I guess after this Monday, your next homework 7 or adaptive practice for Chapter 8 is due the following Monday. So just make sure you're staying on top of all of those assignments. I know it's probably easy to forget them and just think that they're not important, but just recognize that they do add up in points, and so staying on top of those. One thing that is not on this list that's worth mentioning is we also have the pro section. We're gonna work on my writing pro section. Due also on Friday, so please make sure you look at that. That is listed on Wiley Plus, so that's on Wiley Plus, and that is also due by Friday at midnight. So that's where you can find the Wiley Plus. There's 2 parts to that pro section 1 and pro section part 2. Make sure you complete both of those, and both of those are worth a total of 25 points. We have 4 pro sections over the course of the semester, so 25 points times 4 equals 100 points, and hey, look at that. That's almost exactly the same amount of points as your last exam. So I've tried to create these other opportunities for points getting. You know, this is the pro sections are open book, open note. So as long as you sit down and take your time with them, you should be fine. And the pro sections for this particular instance is primarily labeling. So just make sure that you're spending some time to look at those labels. Okay. So just an additional heads up for this particular week. Make sure you're taking care of your pro section. Okay, so your study guide questions for this particular chapter, some of them are going to be almost seeming kind of repetitive because you're going to be talking about location and surface features of specific bones. This is, again, why many people take anatomy and physiology, is to do things like memorize bones, memorize muscles. And so this is where we kind of get into the meat and potatoes of this course, where we're actually doing that. We're looking at both bones now and then muscles here in the next couple chapters. So, okay, so the axial skeleton. When we talk about the axial skeleton, we'll be, again, talking about the 2 different parts of the skeleton here in a second. But the axial skeleton is very important for protection. And I think of the axial skeleton as being kind of the protective parts of our skeleton, right? Think of the organs that are probably the most important for our body's function, things like our brain and our cardiovascular system. The axial skeleton protects those regions, and so it's going to include the cranium that surrounds the brain. Today we'll be focusing on just the skull and the bones in the skull and the vertebrae that surround the spinal column. We'll talk about those more on Thursday, and then the ribs that surround the heart and lungs. So again, very important structures for maintaining, you know, the homeostasis of the body is by protecting those very important organs that are critical for function. Obviously, your central nervous system is, I guess, severely important for you to be able to be a functioning, you know, human, as well as the cardiovascular system that provides, you know, oxygen and nutrients to all the different regions of the body as well. Bones also support the storage and release of calcium, something that we talked a lot about the last lecture. So again, in addition to serving a protective role, it also has an important role in calcium homeostasis. Okay, so I keep talking about the divisions of the skeleton. We're talking about the axial skeleton, but if we break it down into the 2 main sections of the skeleton, you have the axial skeleton, which contains 80 bones. And so you've got skull bones, auditory ossicles, hyoid bones, ribs, sternum, vertebrae, and sacrum. Today we'll be going over skull bones. We'll mention the hyoid bone at the end of this lecture, and then we'll be covering the remaining of these axial skeletal bones in the lecture on Thursday. So the axial skeleton, like I said, has a huge function in a protection of these very critical organs. Now, to contrast that, the appendicular skeleton, this is going to be the focus of chapter 8, has 126 bones, and bones of the upper and lower extremities, and bones forming the girdles that connect the limbs to the axial skeleton. So there's obviously an interaction of both the appendicular and axial skeleton, but you can think of the appendicular skeleton as being kind of your extensions of your body, so your arms and your legs, as well as your lower girdle. And this 126 bones might be a little kind of unnerving. Just recognize that the appendicular skeleton includes our phalanges, and so our hands and our feet have a ton of bones located in them. So that's actually what makes up a good number of those. So yeah, so we're seeing these large numbers. We've got 206 bones, but let's do some quick math here. Again, your number of bones in your axial skeleton is 80. The number of bones in the appendicular is going to be 126. So let's look at where these bones are distributed. So today we'll be talking about the skull as well as the hyoid bones. So you can see here that there are essentially 22 bones contained in the skull. We've got 8 in the cranium and 14 in the face, and then we've got that hyoid bone we'll talk about as well. The remaining of these bones we'll be talking about in Thursday's lecture. And again, this is just basically what we're covering in chapter 7. So don't get too overwhelmed. This number of 80 might seem very large, but when we get to even talking about the bones of the skull, there's some kind of pairs or repeater bones here that kind of knock that number down in terms of the words that you need to memorize, which actually makes things a little nicer. So again, these are the 80 bones in the axial skeleton. You can also see that the vertebral column has a lot, 26 bones as well. If we look at the appendicular skeleton, in comparison, you have your pectoral girdles, your upper limbs, your lower limbs, and then your pelvic girdle. You'll notice here that the big numbers come from your phalanges and both of your upper and lower limbs, 28 in each. And so that's really going to contribute to that number of 126. So your phalanges as well as your metatarsals and your tarsals are all going to be, parts of your hands and feet. So it's not surprising that there's a lot of small bones located within them that we'll kind of have to work on. But other than that, a lot of the other bones that are included in the appendicular skeleton are fairly large bones and bones that you probably have heard of before. Things like your clavicle, your scapula, your humerus, ulnus, and radius all are going to hopefully be bones that you've maybe heard described in the past. And so yeah, hopefully again this doesn't seem too daunting of a task to be able to start to memorize these bones in both your axial and appendicular to skeleton, and just recognize that these, the material for this is covered over 4 different lectures, and so I'm hoping we're kind of breaking it down to very manageable components. So for example, today there's only 23 bones, and like I said, there's some repeater paired bones, and so it kind of knocks that number down even much lower than that. So don't get overwhelmed. Like I said, there's going to be some images here that might seem overwhelming. So just keep in mind that I'm gonna try to make this manageable for you. Okay, so again, if you're a very visual learner, if you enjoy these videos, please make sure you're opening up the PowerPoint associated with this, and then also have your browser open as well. And so if you click Divisions of the Skeletal System, you should get a really nice video. Okay, so types of bones. When we're talking about types of bones, it's really talking about different ways in which we characterize bones. So first way we characterize bones is through bone shape. And so the shape of bones is different, obviously, depending on the structure and function of the bone. That's an important relationship that we'll talk about several times over the course of this course. We've talked about long bone quite a bit, especially in the last chapter when we were talking about the structure of the diaphysis and the metaphysis and the epiphysis, as you can see here in the humerus. So this would be your epiphysis, this would be your diaphysis, and this would be your metaphysis right in that center. Again, I'm just quickly reviewing these, just hopefully because that gives you a sense of like, oh yeah, I've seen this before. So this is your humerus. Another long bone that's very popular to look at would be your femur. Again, not surprisingly, another very long bone in the body. It's great in length. Other kind of characteristics of long bone is the fact that diaphysis is composed primarily of compact bone. And then if you look at the epiphyses, you've got spongy bone located kind of in the center of them. And then you still have the compact bone that surrounds the outside of that particular bone. Next, you have short or cube-shaped bone. So here you can see an example of a cube-shaped bone. This is found in your wrists and your ankles, these cube-shaped bones. What do I have written here? They're going to be basically a spongy bone inside and then just have a nice layer of compact bone on the outside of those bones. Flat bones are going to be thin layers of parallel plates. So examples of a flat bone, here we're looking at the sternum, so that's located in the center of your chest, and we'll start talking about different ways to describe kind of the shape of the sternum, but flat is one way in which it's characterized. In terms of flat bones, for the most part, you're going to see that composed of, again, that layer of compact bone on the outside, and then some small amounts of spongy bone on the inside. Irregular bones, they're just complex shapes that really don't fit into any of these other categories. And one example of that is going to be the vertebra that, again, lends the entire back of a person. That irregular bone of that vertebra has just kind of an irregular shape, that doesn't fall into these other types of groupings. And so the vertebra kind of are the bulk of what we would call an irregular bone shape. And we'll be going over kind of, again, some of the structural features of the vertebra here in a second. And lastly, we can see the sesamoid. It's shaped like a sesame seed. Probably the most visually apparent sesamoid bone is going to be the patella, part of your kneecap. And it's, again, kind of that flat-ish type of shape of bones. So there's quite a bit of compact bone that's making up that particular structure. Just recognize compact bone is far stronger than the spongy bone. And so in regions where you have an area that's getting impacted, has a lot of force coming into it, you're going to probably want compact bone composing those types of bones. So the sesamoid bone of the patella is probably a great example of where you'd want compact bone, just because there's a lot of force that's sometimes applied to the patella. Okay, so in addition to memorizing bones, other things that we'll need to kind of think about are sutures. And so since today we'll be talking about the skull, we'll also be including our conversation on sutures. So sutural bones are small extra bone plates located within sutures of the cranial bones. And so this is where flat bones comes together. So your skull is actually kind of situated into these large flat bones. And you can see here the suture lines are along this red line that I'm drawing here, and you're bringing together different flat bones to form almost what looks like one continuous structure of the skull. But within each one of these flat bones are each kind of their own bone, and we'll see that you have a parietal bone, a temporal bone, occipital bone. What's nice is that these terms might seem a little foreign to you, but it definitely is worth getting comfortable with them, and it's going to come to pay off later, because actually all these bones correlate to the different regions of the brain, underlying brain. And so in that way, you almost can double dip with your knowledge base. If you're like, oh, this is where the patella bone is. Well, it's actually, I'm sorry, not patella, parietal bone. And it's also the parietal region of your brain. So again, kind of overlaps, and you don't have to memorize things twice. So the sutures are where these are joined together. And we're going to talk about how these sutures form developmentally, and what they look like when they aren't fully formed in a young adult, an infant. So sutures are where these bones come together. We'll be learning about the names of different sutures in the skull as well. Okay, so bone surface markings. So there's a lot of different ways in which you can describe a bone and the way it appears and the shape and kind of structure of the bone. And so these are all, we're basically going to go into the terminologies, describe how you would describe bone surface markings. Some of these terminologies are very specific for specific bones. Some of these terminologies are more general and you could use for several different types of bones. In terms of bone surface markings, when we get to the section of this lecture talking about the skull and the cranium, there's going to be a lot of descriptors on those slides and to describe the bone surface markings for those different bones. I'm going to tell you that you can kind of disregard those. In terms of bone surface markings that you'll be expected to know, you'll be expected to know the ones that are included either in the table that's presented here or on the images that are presented right after the table. But I'm not going to make you I'm not going to show you a random bone that isn't in one of these two locations and ask you to describe the bone surface markings. Again, I'm just trying to kind of bring this down to a very manageable place in terms of understanding and just getting a good basic understanding of the skeletal system. Okay, so again, bone surface markings, bones have specific characteristics. Again, the structure of a bone is going to aid in its function. And if we look at kind of the overall two different types of bone surface markings, you can have depressions and openings, and this is going to allow the passages of soft tissues or things like nerves or arteries through a particular bone, and we're going to see that a lot within the skull. Second, you have processes. So these are projections or outgrowths that form joints, serve as attachment points for ligaments and tendons. And so these are kind of the knobby parts of bones where these processes allow for attachments of these other soft tissues that allow for things like movement. So we might see more depressions and openings, I would say. We're looking at the axial skeleton and then maybe more processes in the appendicular, but you do have both types of bone surface markings in both regions. Okay, so what's the way this particular lecture is structured is we're going to go through these tables describing the different types of markings, and then we're going to look at actual pictures of each one of them following. So if you're a very visual learner, don't be dissuaded, because you will be able to see actual images of what these bone surface markings look like. So first, a fissure is going to be the narrow slit between two adjacent bones where blood vessels or nerves pass. So the example that they're giving you here is a superior orbital fissure of the sphenoid bone. We'll be looking at the sphenoid bone a little bit later. Again, this is just a region in which you have blood vessels and nerves passing through. So like I said, if you're a visual learner, then bear with me. We'll get there in a second. A very similar foramen is going to be an opening through which blood vessels pass through. The optic foramen of the sphenoid bone. The foramens tend to be fairly large in their size. A fossa is going to be a very shallow type of depression within a bone, and we're looking at the coronoid fossa of the humerus. Sulcus is a furrow along a bone that accommodates blood vessels, nerve, and tendons. So we can see here the intertubercle sulcus of the humerus. And again, these types of bone surface marking descriptions kind of go between both axial and appendicular skeletal regions, obviously, because here we're using the humerus as an example. Next, you have the meatus. This is a tube-like opening, and here you can see the external auditory meatus of the temporal bone. So when we get to the area where we're talking about the temporal bone, that's located right here along the sides of your head, obviously you're going to need to have some type of auditory input and output, and so the external auditory meatus of the temporal bone allows that to happen, and so it's a tube-like opening. Next here you can see we're talking about processes, a condyle, and this is a large round protuberance with a smooth articular surface at the end of a bone. So this is kind of what we think of, I think, when we think of an epiphysis, and this is the lateral condyle of the femur as an example of that. Other types of markings, a facet, which would be a smooth, flat, slightly concave or convex, and we see that within the vertebra. And then the head is usually a round articular projection supported on the neck, and that's also seen in the head of a femur. So this seems like a lot, and again, we're going to see some pictures of these. And I'm not going to necessarily require you to be able to apply all of these bone surface markings to every single bone that we look at. Okay. The crest is a prominent ridge or elongated projection. So the iliac crest of the hip bone, when we get to talking about the appendicular skeleton, we'll definitely see that very clear and apparent, the crest of the hip bone. Epicondyle is just a roughened projection above the condyle. So the medial epicondyle of the femur. A line is a long, narrow ridge along a border, the lineal aspera of the femur. And again, these are more appendicular than axial skeleton descriptions. Spinous process is a sharp shoulder projection. So you actually, when you think of a vertebra, there's that kind of peak that comes off of that vertebra. So the spinous process of a vertebra is very kind of apparent, and it makes sense that it would be called a spinous process. A trochanter is a very large projection, so think of the greater trochanter of the femur, and we'll talk about that much more when we get to chapter 8. A tubercle is a variable size rounded projection, so the greater tubercle of the humerus, and then the tuberosity is a variable size projection that has rough, bumpy surface, and so the Ezekiel's tuberosity of the hip bone is an example of that. Okay, so we've worked our way through these bone surface markings. So let's actually look at some actual picture examples. So an example of a fissure, one was given in that table, but here we also see the narrow slit of bones for the passage of blood vessels or nerves. So here you can see within this fissure, the superior orbital fissure that's located right here. The foramen, so I said before, like the foramen is a very large opening for the passages of blood vessels or nerves or ligaments. So here you can see the foramen magma, which is again kind of the large opening at the base of the skull that allows the articulation with the vertebra. Fossa, a shallow depression. So an example of that would be the mandibular fossa. We'll see the articulation of the mandible with that particular location. So this is a very shallow depression that occurs here, just at the base of your zygomatic bone. We talked about the sulcus, a furrow on a bone, a passage of blood vessel, nerve, or tendon. We'll see that in the humerus when we get to the humerus, in the appendicular skeleton section of chapter 8. The meatus is a tube-like opening. So here we get, as you can see in your temporal bone, the external auditory meatus. And so that allows output or input, I guess, of sound into our skull. Next, the example that we see here is a condyle. It's a rounded smooth projection with articular surface. So here you can see the epicondyal, occipital condyle. Again, this is part of the occipital bone in the skull. So you can also see here this rounded projection of a smooth surface. Again, this is important for kind of how the skull sits onto that vertebral column. A facet is a small, flat, slightly concave articular surface. So here you can see a superior articular facet. Again, we're looking at a vertebra here, and you can see an inferior articular facet here as well, and then an inferior demifacet, a superior demifacet. And so these small, flat surfaces are found in several different places on your vertebra of your vertebral column. A head, again, is a usually rounded articular process supported by a neck. So if we look at our example here of the rib, you can see the neck, and then the head kind of is supported from that neck. So it kind of makes sense and mimics some of what we see in the body. Less crest here, you can see the example that was given in the table was the iliac crest of the hip bone. Here you can see the lateral and medial sacral crest of the tailbone. So they're just getting kind of a couple different examples, both in the table as well as what you see here in the pictures. Epicondyle is going to be a usually roughened projection on a condyle. And so you can see epicondyles in relationship to the condyle when we look at the humerus and femur. A line is a long narrow ridge along a border, less prominent than a crest. So here you can see the superior nuchal line and the inferior nuchal line, and those are going to both be part of the occipital bone on the back of your head. As I pointed out in the table, the spinous process, probably the most apparent spinous process that we can think of, is going to be the spinous process on the vertebra. So you can here see that spinous process on the vertebra. So the vertebra actually have a couple different very apparent markings. Again, it's that irregular shape that gives them so much structure. Trochanter is a very large projection found only in the femur. So when we get to the femur, we'll see an example of that in chapter 8. And a tubercle is a variable size rounded projection. So here's an example of the tubercle of a rib that's articulating with a vertebra. Tuberosity, a variable size projection through rough, bumpy surface. And again, we're looking at the tailbone here. We can see the sacral tuberosity located on that tailbone. Okay, so again, those are bone markings. Again, that's how we would use, those are the types of words we would use to describe different types of bones. Like I said, my expectation is that you are able to memorize some of the examples that are given either in the table or in the image. So hopefully by doing that, we're cutting down the overall number. But just make sure you can apply those particular descriptors to those either table or pictures that are presented. Okay, so this particular slide, so we've got this skull. The skull contains 22 bones, not including the 3 middle ear bones, and associated bones are the number these bones are a number of processes, ridges, lines, depressions, and formna. So I'll just say right now that I'm not going to ask you to memorize these, except for we will be memorizing the sutures. We will be memorizing the sutures that are associated with the larger bones of the skull. Okay, so I'm going to use my amazing handwriting to try to break this down. So for these 22 bones, we've got essentially 8 pairs of bones. So 8 bones that we see twice, that occur twice. So these pairs of bones. So the first one will be the parietal and parietal. Ooh, this is going to be rough in terms of parietal. There's 2 parietal bones in the skull. Then next you have 2 palatine bones. Palatine. Wow, there's got to be a better way to do this. Also in the skull, I'm going to try text here for a second. 3, you've got 2 lacrimal bones. 4, you have 2 zygomatic bones. 5, you have 2 temporal bones. And 6, you have 2 nasal bones. Okay, 7, you have 2 maxillary bones. And then lastly, 2 nasal concha. I can't hide my terrible spelling with bad handwriting now. Okay, so again, these are going to be your, you've got 8 different pairs here. So in contrast, if we go the single bone, so you've got 6 single bones. And so if we go those 6 single bones, you have your frontal bone, 2 is your ethmoid bone, 3 would be your sphenoid bone, 4 would be your mandible, 5 would be your occipital, and then 6 would be your vomer. Okay, so again, kind of trying to keep things as, I guess, manageable in terms of memorization. What I've done here is I've basically given you the list of the bones that I'm going to expect you to know for the skull. So you've got parietal, palatine, lacrimal, zygomatic, temporal, nasal. So essentially we have 8 plus 6, we have 14 different bones to memorize. And like I said, 8 of those are pairs. So hopefully that, again, kind of gives you a little bit of confidence saying, okay, 14 bones, I think I can memorize that, right? So just keep that in mind as we're going through this lecture. These remaining slides are going to have a lot of different labels on them. And so I'm just going to try to continually just circle the things that I'm going to expect you to know. And those circles are primarily just going to be these 22 bones. I'm not, again, going to have you go into the different ridges, lines, and depressions as much. Okay. So erasing. And let's start going through these bones of the skull. Okay, so when we look at the just the anatomical arrangement of the bones of the skull, here you can see again probably one of the largest and probably most apparent bones easiest to memorize would be here, this frontal bone. So that bone that makes up your forehead. To the side of your head, you'll have your parietal bone. Like I said, your parietal bone is going to also be covering up and protecting the parietal lobe of your brain. And we're going to see many of these bones in various different views. So this is going to be your anterior view, but we'll also see posterior, and then we'll also be seeing different through different, I guess, planes as well. Your ethmoid bone, we'll be talking more about your ethmoid bone a little bit later on. We'll just follow this line here. You can see that ethmoid bone It's a little bit easier when we do a different plane. The palatine bone, again, this is going to be one of those, you've got two palatine bones, you've got two parietal bones. Here's your lacrimal bone, there's two of those as well. So if we follow the line of that lacrimal bone, here you can see that kind of light purple area right here. Your zygomatic bone, you've got two of those. Those zygomatic bones make up those amazing cheekbones that you have hanging out in your face right now. And then here you can see your inferior nasal concha, located just right here inside of that particular hole. And down the center of your nose, you've got that single vomer. So you've got two inferior nasal concha. We keep kind of, again, going down through the bones. So the temporal bone, maybe I didn't, I guess, give a great description of the parietal bone. So the parietal bone is going to be up here. Your temporal bone is going to be here on your side. So you've got two temporal bones that are covering your temporal lobes of your brain. Your sphenoid bone is another single bone here that doesn't have a pair. It's going to be this green color that you see inside here. And when we go and look at it through a different plane, it'll be much more apparent. Your nasal bone, you can see here in that red, and the maxilla bone, again, is another single bone that you'll see here. And then lastly, your mandible. So we've gone through, we've seen quite a few different bones here. I'm trying to see if which ones we've omitted, but again, if they're not apparent here, so like the occipital bone is going to be one that's omitted because we don't have, we can't see it through the anterior view. Okay, so anything circled in red here, again, these are part of the 22 bones of the skull. These are the types of things you'd need to be able to label on an exam. Now, you'll recognize here that it's giving you a lot of other descriptor words, things like the orbit, which is going to be the opening for where your eyes are located at. You will see that there are also other descriptors like your zygomatical facial foramen. Again, we just went over what a foramen is, and it's zygomatical facial. Obviously, it's going to be part of your zygomatic bone. So again, these are all just describing the bones themselves, whether it be things like their foramens or fissures or a concha. Those are all going to be descriptors of the bone structure themselves. Okay, so that was your anterior view. So if we look at your right lateral view, you can kind of get another sense. So that parietal bone, you can see kind of extending over the top part of your head that kind of complements the frontal bone that's making up your forehead. In other bones of your skull would be things like your temporal bone, is going to be right here along the sides of your head. And then the very back of your head is going to be your occipital lobe. And that occipital lobe is going to form a suture with your parietal and your temporal lobe. And we'll start talking about sutures here a little later on in the lecture. So we've got parietal, temporal, occipital. What else do we need here? We've got our mandible, and we'll talk about our mandible more in depth later. Your maxilla, the nasal bone, and then here we've got our lacrimal, ethmoid, zygomatic, and sphenoid bone, all from the lateral views. So here you can see just kind of the sphenoid bone. When we actually go through a different plane and we cut through the center of the skull, you'll actually get to see how kind of in depth in the different structure of this, both the sphenoid and the ethmoid bone, because they've got some really interesting internal structure. The zygomatic bone, again, is going to make up that cheekbone, and that maxilla is going to be the kind of the top part of what you would consider where your teeth are embedded. Lastly, you have your mandible, again, part of your jaw. If we look at the superior view of the skull, again, that forehead, it's going to be that frontal bone. You can kind of see that zygomatic bone, your cheekbones poking out from the side, and then your parietal bones and your occipital bone. Those are going to be the main bones of the skull. So I'm trying to keep this very manageable. I keep saying that, but I'm going to keep saying it so you don't get overwhelmed and just recognize that a lot of the things I'm circling are repeaters, right? I think we've circled the zygomatic bone on every single one of these images. So it's just showing you that same bone from a variety of different angles. Okay. Okay, so if we look at a medial view here, again, this is where things get kind of interesting for bones. Like here, this blue, I'm sorry, blue, colorblind now. This green bone that you can see here is going to be your sphenoid bone. So here you can see your sphenoid bone, and then also the other interesting internal structure bone is going to be your ethmoid bone that you can see here as well. So that ethmoid bone is going to be that kind of light pinkish bone that you see here. You see that there's a bunch of different kind of structures, the different plates and fosses that are located within them. Also, what's very clear with this, this medial view is you can see the frontal bone. We've already gone over the sphenoid bone. The sphenoid bone, again, is this bone in the green. You can see the cross-section of the maxilla. Let's see, the mandible is also visually apparent here, as well as the occipital, the temporal bone, and the parietal bone. What's also kind of interesting is through this medial view, they've shown the 3 bones of the ear, the incus, the malleus, and the stapes. So here's your 3 bones that are located in the ear. What other bones did we miss out of here? The nasal bone. So again, although I'm trying to again keep this very manageable, you can see the different sutures that are showing here from different angles. And so once we talk about sutures, these might be some good slides to come back to, just because it shows you the sutures from different viewpoints. And so this medial view does allow you to see things like the squamous and the lambdoid suture in just a slightly different orientation than you would if you were just looking at the anterior or posterior view of the skull. Okay. And again, since we're looking at a medial view, this is a sagittal section. Sagittal, this would be a mid-sagittal section, essentially right down the center of the skull. Okay, the postero-inferior view of the skull. So you've kind of essentially kind of tilted the skull kind of up, and you're just looking at kind of this back part right here. So you've got your 2 parietal bones kind of located here. You've got your occipital bone located far back here. So you can see kind of that occipital bone being the most kind of visually apparent bone located on this particular image. You also have those 2 parietal bones. You can see that they're joined here by that sagittal suture. We'll also talk about some of these suture bones. These are 2 suture bones that are holding together the parietal and occipital bones. You can see the lambdoid suture kind of runs the border between the parietal and occipital bones. And then you have your 2 temporal bones located on each side. And then if we look at kind of, again, you're looking kind of down and up, kind of in through that foramen magma, that you can see the vomer located right here. And then lastly, you're looking at kind of the very bottom of the head. So you can see the bottom of the mandible located here. So when we were talking about those different types of descriptors, remember foramen magma was one of those descriptors, so you can kind of see a version of that right here. We also talked about the occipital condyle, so it's kind of nice to see how that kind of I guess compares when we're looking at everything kind of put together. Okay. So again, focus on the bones. Focus on any other words that might look familiar to you in terms of describing processes and such. So again, that occipital bone located in the back of the head, very apparent. You can see those nuchal lines. Again, those were examples of descriptors that we saw before, the superior and inferior nuchal line. They're not as kind of apparent as like a spiny process, but still kind of creating kind of a ridge nonetheless. The the occipital bone is actually going to also cover the occipital lobe of the brain. Okay, so if we look at the inferior view, so if you literally just took the skull, put it in your hand and was just looking at it down from the top, not surprisingly, one of the most apparent things here is going to be that foramen magma that you see here. And again, the occipital bone is making up that back of the skull you see right here on the posterior. And here you see a parietal bone, just kind of the sides of that here and here. And then this purple bone that you see here and here are going to be parts of the zygomatic bone. So that purple bone is really kind of taken up a big chunk of that. Oh, sorry, that's not the zygomatic bone. That's a parietal bone. Or sorry, the temporal bone. This is the temporal bone that's shown in purple here on each side, temporal. Sorry, the image was shifted for me just a little bit. So the temporal bone is shown on each side here and here, and your zygomatic bone is more located towards the interior of the skull. So you can see that zygomatic here in your zygomatic arch. The maxilla, here you can see kind of the base of that, kind of the roof of your mouth. Other things worth pointing out, you can also see the vomer from this angle as well as the palatine bone, which the palatine bone is going to be making up your part of the upper palate of the top of the roof of your mouth. Okay, so again, just different angles to look at these bones. You know, since we aren't able to kind of hold these bones and look at them in a three-dimensional way, we're basically rotating through the skull and looking at all of the different possible angles, and then basically relabeling these bones in all these different orientations. So don't get overwhelmed. We only have those 22 bones. There are pairs of bones. So each orientation is going to look just slightly different. Okay, so I pointed out that the ethmoid bone and the sphenoid bone have kind of their own interesting architecture. So you can see here the superior view of the sphenoid bone. It's kind of a winged structure. It's a very interesting bone. It's going to be important in forming different fissures and sutures within the brain, not within the skull. And so here you can see how it kind of interacts with all of the different parts of the skull. So you've got the articulation with the ethmoid bone here. It articulates with the frontal bone as well. And then within the sphenoid bone, it's almost like it does look very much like a wing structure. And so within the sphenoid bone, you have a lesser wing and a greater wing. So you can see those two wing structures here and here. And then the main body of it as well. And there's also a number of foramens because you do have vessels that are going to be passing through the sphenoid bone. Other things about the sphenoid bone is, again, it's important kind of area of the skull where multiple different bones are articulating onto that sphenoid bone. Other bones to kind of note from this view are things like the temporal bone that you can see here in purple, and then the occipital bone that you see in this kind of peachish color. One thing that's nice, and I probably should have recognized this in the last when I tried to mislabel the temporal bone, is that they're keeping the color structure for each one of these bones the same throughout each orientation. And so if you're able to label your first, you know, in your first figure, the frontal bone is blue and the occipital bone is kind of this peach color, that stays the same throughout all the different orientation changes that occur. So hopefully that also helps things kind of seem repeated. The ethmoid bone is going to be an important component of our sinus cavity. So here you can see the area, and we'll talk about the sinus cavities here in a second, the sphenoid sinuses, but then you can also see that there are these ethmoid cells that of the ethmoid sinuses, so these large kind of openings within them. So those openings are going to be important just for the passage of air. And then when we talk about the functions of the sinuses here in a second, but you can kind of see how it's articulating with several different bones within the skull. Okay. And you can see here the interior view of the ethmoid bone as well. It's got this crista galli, kind of that large spiny process off the top of it. And then you can also see that there's a perpendicular plate that extends down through it. It's going to be, it looks very similar, or it's not looks very similar, but it's similar in its placement to where the vomer is found. But you can see here, you've got your nasal concha on each side, and then your perpendicular plate of the ethmoid bone that's extending down into the nasal cavity. So in terms of like the smaller structures on both the sphenoid and the ethmoid bone, I'm not going to be asking you about those per se. I'm just kind of going through them because I think that gives you a better sense of the structure of those particular bones. But again, you don't necessarily need to memorize those. Okay, so when we focus in on just the facial bones, here you can see the frontal bone located here, the sphenoid bone, which we just talked about, located here in green, The palatine bone, again makes up part of the, I think it's just a little blue dot that you see there, makes up the top part of the palate, and then your zygomatic bone, which is going to be kind of this pink bone here, making up your cheekbone. The maxillar bone is going to making up the top part that you see here, that complements the mandible below. So here you can see the mandible. And then your nasal bone is going to be that ridge right there. Your lacrimal bone is going to be kind of between your ethmoid bone and your nasal bone. And so your ethmoid bone is just going to be located right below those to provide those provide those sinus cavities. If we zoom out, you can see, again, we just keep pointing out the same bones, but in different orientations. That frontal bone, that parietal bone, ethmoid, palatine, lacrimal, zygomatic, again, all part of the facial bones. Here you can see the inferior nasal concha located right here next to that foramen, the vomer, as well as the maxilla, nasal bone, sphenoid bone, and temporal bone. Again, this is just kind of just going over these multiple times, making sure that this repetition kind of helps you see that there's not a ton that you need to memorize here. It's just different orientations. Okay, so the volar, maxillae, and zygomatic bones, if we kind of zoom in onto those parts of the facial bones, here you can see the vomer is going to be this bone here that articulates with the this particular bone right here of the ethmoid bone, so the perpendicular plate of the ethmoid bone. So you have your vomer, your ethmoid bone, and then so it's interacting with that, as well as your zygomatic bones, which is creating that upper face structure that you see there in pink, and then your maxillar bones, which is creating kind of the top part of the front of the face as well. Okay, next, the mandible. So we've covered a lot of the center of the face. If we look at kind of the base of the face, you have your mandible, the lower jawbone. It's a great example of a condylar process that you can see here. There's also this flat area that you can see here is called the ramus, in the body of the particular part of the mandible right here. There's a foramen here called the mental foramen. Again, it's allowing for passageways of different nerves and vascular elements. Here you have your mandibular foramen and the choroidal process. Now, you don't need to be able to label all these different areas of the mandible. Just again, make sure that you recognize the mandible itself, and maybe this is a great example of a condylar process. Okay, the nasal septum. So if we look at a mid-sagittal plane view of the nasal septum, you can see the combination of the frontal bone, the nasal bone, as well as the nasal septum, which is made of that ethmoid bone, as well as the sphenoid bone. So right there, kind of down the center of the face, you have your vomer also, that's very apparent there, and the palatine process of the maxilla. So you're just basically seeing, again, that mid-sagittal plane of those different bones articulating with each other in that very central nasal septum area. The orbit's going to be this large opening that you see here for the eye, and you've got several different bones articulating there. You've got your frontal bone that's providing kind of the top component of that, your sphenoid bone that's kind of at the back of the eye of this orbit, as well as your palatine, your zygomatic, your nasal bone, your lacrimal bone. Again, your lacrimal bone is going to be that very small purple bone you see right there, as well as your ethmoid and your maxillar bone. So these bones, again, are going to make up the orbit, the hole that holds your eye. You can see how many different bones are articulating in that single region, and how many different kind of fissures and foramens are located in that area. Again, your face has a lot of nerves. A lot of your cranial nerves are innervating your face. If you think about how many different facial expressions an individual can make each one of these different foramens are basically allowing for nerves to innervate the musculature of the face and allow for those expressions to occur. Okay, so other components of the orbit, think of the carotid, the hypoglossal canal allows for the hypoglossal artery. Again, when we talk about cranial nerves, which we'll talk about in several chapters down, these cranial nerves are numbered. You can see here it says the 7th cranial nerve or the hypoglossal nerve. And so that cranial nerve is going to actually go ahead and innervate through that hypoglossal canal. Infraorbital foramen as well. So these are all kind of holes or within the orbital canal. And again, you have another nerve innervating there, another cranial nerve, your trigeminal nerve. Your jugular, you have your structures passing through your vagus, your accessory, and your glossopharyngeal. These are not things that you need to memorize at this point in time. Just recognize that there are foramens that are located within the facial structure and the orbital structure of the face that allow nerves to innervate and allow for things like expression. So I'm not going to go into these a ton, just because I think we'll again cover that material a little later on in the class. So, your lithorum is going to be bound to your arteriosphenic bone. Your magnum is going to be that large and foramen through your occipital bone, and the mandibular foramen again allows for the inferior alveolar nerve and the blood vessels to pass through. Mastoid, mental, olfactory, optic. Again, these are all types of foramen that are allowing different innervations of either vessels or nerves to come in. And I'm not going to make you memorize these or know these. Again, the big picture of this particular lecture, know the 22 bones of the skull and the face, and the sutures. I mean, again, this is good, important information to have in case you want to go back and reference it later on. But I think it's going to be a little bit further into the kind of memorization scheme, because I think if I had you do this, you'd probably all freak out. Okay, so unique features of the skull. So outside of just those 22 bones, the other thing I want you to focus on are these sutures. So the sutures is where you have an immovable joint and the fusion of two flat bones. So these are found in the skull that hold together bones, such as the temporoparietal. So you have your coronal, sagittal, lambdoid, and squamous. And so you have 4 different sutures. So again, trying to keep the memorization to a minimum, you've got your 22 bones and your 4 sutures. So let's look at where these sutures, we not have, no, we'll have to go back and look at the sutures on previous images. Okay, so this might be one of the better figures for that. So here you can see the location of the sagittal suture. So if you remember sagittal plane down the center, mid-sagittal plane, your sagittal suture is going to be down the center of your head, and that's going to, the sagittal suture is going to bring together the 2 different parietal bones that are coming together on each kind of side of your skull. You can see here, we also have your lambdoid suture. Your lambdoid suture is going to bring together the 2 occipital and parietal bones that you can see there. And then I think we're going to need a different plane. Okay. Okay, this is also nice because you can see several different sutures from this. So here you can see your coronal suture. So your coronal suture is going to suture your parietal lobe and your frontal parietal bone and your frontal bone. And then if we look at the lambdoid suture again, that's kind of suturing your parietal and your occipital. And then I don't know if they have the other suture. I think we're gonna have to go one more different plane. Okay, and so the other suture that we're going to see here is your squamous suture. So your squamous suture is going to run this, this kind of pairing here between your temporal and your parietal. So your temporal and your parietal bones are going to be sutured through the squamous suture. So we have squamous, squamous suture, your coronal suture, let's see, your lambdoid suture. I'm trying to see if there's any other sutures we've got here. Okay. So again, just had to go back through and make sure you had kind of a visual of each one of those sutures that we just covered. Okay, so Other unique features of the skull is that we have sinus cavities within them. Those are going to be important for just cleansing the air that we're breathing in. And those are going to be composed of the different bones that are articulating together, of the frontal, maxillary, sphenoid, and ethmoid bones. As we remember looking at those bones, they've got those large kind of areas of holes, and those are mucus-lined areas that allow for basically filtration of the air that we're breathing. So they also are used as resonating chambers for our voice. And so when we're creating sounds to come out of our face, essentially the sound is able to resonate in those areas, and keeping those moist areas moist. And it's also a first line of defense for any kind of foreign invaders that we're inhaling. We do have parts of our immune system that are existing in that mucosa to kind of break them down. You can see in the paranasal sinuses that you have your frontal sinus, your ethmoid cells of the ethmoid sinus is located here, these kind of pink areas. We remember when we looked at the ethmoid bones, there were those large cavities within them. Here you have the sphenoidal sinus, part of the sphenoid bone. And lastly, you have the maxillary sinus, which is going to, again, be located right underneath that maxillary bone. So not shockingly, many of the different sinus names are correlating directly to the bones in which they're encapsulated in. So again, if you have a sinus headache, it's very apparent in those regions located there. Okay, and this is just a nice sagittal section showing you those different regions. It's internally, so you can see the sphenoid sinus, no, we don't have maxillary sinus here. We've got the sphenoid sinus as well as the ethmoid sinus being shown here. So I'm not going to go ton into the sinuses. Okay, so fontanelles. So we talk about development during this whole process. So those sutures that we just went over, prior to those sutures actually fusing, which you're going to have located in an infant or young child, is you're going to have fontanelles instead. So when a baby has these unossified mesenchyme, and which develops into dense connective tissue, so you've got these areas or these fontanelles that are allowing for the growth of the skull. So here you have your anterior fontanelle, your anterior lateral fontanelle, your posterior fontanelle, your posterior lateral fontanelle. And these eventually give line to, your future coronal suture, your future squamous suture, your future lambdoid suture. And again, each one of these sutures are going to give rise to kind of those lines, and they're bringing together those flat bones when they're in their fully mature stage. But during the growth phase, those first 3 years of life, you have fontanelles. And so these tend to be why babies' heads are kind of just, going through a lot of shape changes, as my own child has done. And it's been interesting. Every now and again, I'm looking at him and being like, hope you don't look like an alien forever. But he's okay now. The last bone we're going to go over today is the hyoid bone. So it does not articulate with any other bone. It's actually held into place via muscle. This hyoid bone is located here at the very base of your skull, provides tongue and attachment to the side with some muscles for the neck and pharynx. So here you can see the larynx underneath, and this kind of white area here is going to be part of the musculature. And so if we look at the hyoid bone, you can see the anterior view of it, as well as the right lateral view. And you can see some of those structural elements that we saw before, things like this greater horn, the lesser horn, as well as the body. But again, the hyoid bone is not articulating with any other bone. It's kind of hanging out by itself and is held into place via muscle. Okay, so make sure you've answered the study guide questions for this particular chapter. Make sure you've taken your quiz by Friday. There might be questions on the quiz that do go into specific descriptions of these bones. But like I said, I tried to make it very apparent as to what my expectations are. Know the 22 bones of the skull, pairs or singles, and then know the sutures. That's basically kind of what I would take away from this particular lecture as much as possible. Make sure you feel very comfortable labeling those 22 bones in all of the different orientations. And yeah, again, this is the first part of chapter 7. We're basically just covered part of the axial skeleton. Part 2 will be the next section of the axial skeleton, where we go over to vertebra, as well as kind of the main body cavity. So if you have any questions or concerns at this point in time, please feel free to ask them. And good luck, and everybody have a great weekend.